For smaller grades 1 to 3 internal hemorrhoids, rubber band ligation can be done. This involves placing a rubber band around the base of the hemorrhoid to cut off its blood supply. The hemorrhoid then shrinks and the band falls off on its own, usually within a week, though it may fall off on the same day as we place it. Multiple sessions may be required as we cannot treat all of the hemorrhoids all in one go. While the risks are low, the success and recurrence rate are higher than with surgical options. Since we always want to try less invasive treatment options first, as this may be all you need depending on our assessment, we may recommend rubber band ligation first before exploring surgical options. On that note, if your hemorrhoids do not respond well with medical management and rubber band ligation, or if your hemorrhoids are too severe for consideration of rubber band ligation, only then would we consider surgical management of your hemorrhoids, which include hemorrhoidectomy, laser hemorrhoidoplasty, mucopexy, and rectal mucosal excision. If you choose to undergo rubber band ligation, post-procedure care involves medicated suppositories at bedtime and stool softeners for 2 weeks, as well as high-fiber diet with fiber supplements indefinitely to be adjusted according to bowel movements. Routine follow-up after rubber band ligation is typically after 1 to 2 months. You may repeat the rubber band ligation or proceed with surgery. You will need to schedule this with the clinic, ideally before you leave. After any hemorrhoid procedure, it's normal to experience some varying degrees of bleeding, swelling, and pain, especially during bowel movements. These symptoms typically improve over time. As with any surgery, there will be post-operative swelling, which is normal. It's the body's response to any trauma, including surgical trauma, to help heal that area. Patients may feel this, and it can last anywhere from a few days to several months. Bleeding, while common and to be expected, especially with bowel movements, can sometimes be heavy. Heavy bleeding without bowel movements or passing gas, however, warrants medical attention. Increasing rather than decreasing pain, which may be a symptom of a fissure or a blood clot that would need to be treated. In very rare cases, infection can occur at the surgical site, causing abscess and fistula, which could lead to symptoms like redness, swelling, pain, pus leakage, and fever. Scarring, which can occur in any hemorrhoid procedure, can sometimes cause stenosis or narrowing of the anal canal, making bowel movements difficult. Cutting out surgery like hemorrhoidectomy has a higher risk of scarring versus minimally invasive procedures like laser hemorrhoidoplasty and mucopexy. Rarely, patients may experience incontinence or a loss of control over bowel movements. If this happens, it is usually short-lived, though extremely rarely, this can persist for a long time, especially as one grows older. Urinary retention, where you cannot urinate, may also happen after surgery. This can be due to pain or the effects of anesthesia. Though typically short-lived, this is a medical emergency, and you should visit the emergency department for help urinating if you cannot after 12 to 18 hours. Recurrence or persistent hemorrhoids and its associated symptoms may also occur, as no surgery is perfect. This is why follow-up and lifestyle management is important. Urinary tract infection, or UTI, can also occur, which would require antibiotics to treat. While complications can happen, there are steps you can take to reduce risks and ensure a smoother recovery. Choose minimally invasive options for your chronic disease whenever possible. They allow the quickest recovery with less side effects and complications from surgery. You must ensure that your bowel is properly cleansed before the procedure. By making sure the bowel is clean, we reduce the risk of infectious complications like abscesses and fistula. You must also follow the post-operative care instructions carefully, including maintaining a high-fiber diet and staying well hydrated. Prolonged sitting, heavy lifting, or straining should also be avoided immediately after surgery and for at least 2 weeks afterwards. And finally, we recommend you attend all follow-up appointments to monitor your healing process. Be vigilant and reach out to us for a follow-up, especially if you feel like you are not healing well or something is wrong.